and I am helping you with safe medication administration strategies, okay? Imagine yourself in nursing school in the midst of a pandemic and you do not get the clinical experience that you should have received. Okay, so that's where I come in. I am helping to fill in the gaps with some fundamental nursing principles that you should learn and know prior to becoming a registered nurse, okay? So 5 strategies really quickly, okay? First things first, always use 2 patient identifiers, name and date of birth, okay? You also want to verify that the patient's armband is matching what they are saying, okay? If you do not do that, then you're leaving room for a possible human error, okay? Make sure that that patient's armband matches what they are saying, okay? Very, very important for concise and accurate medical records and also for the safety of the patient, okay? I kid you not, it's been 15 years. I'm back at the bedside, loving it. But just last month, I had a patient whose armband was incorrect. He was a new status post TPA stroke, had a stroke at work, so he was rushed in emergently, having some trouble speaking, and so some kind of way his birthday in the medical record was incorrect. And thanks to the presence of a family member, they were able to actually correct what he was saying, because I was going to chart the patient was confused or disoriented, right? He told me his birthday was in October, which that's my birthday, but his armband said April. Okay, so very, very important to always check your patient's armband for accuracy. Okay. Name and date of birth. Okay, this is the standard protocol. It's universal, probably in every facility in the country. Okay, that's a Joint Commission standard. Strategy number 2, verify what the patient is saying when you're actually looking at their armband, okay? You have to check that armband, okay? Make sure that is accurate. Strategy number 3, you want to make sure that you follow the triple check rule, okay? Check your medications at least 3 times prior to administering them. So your first check, you're going to compare the medication that you're pulling from the Pyxis to the medication administration record that you have in the patient's chart. So this could be on the computer or the printed MAR. You want to compare as you're pulling out of the Pyxis. The second check is going to happen after you've removed all meds from the Pyxis. Some things are in there, some are in a medication bin. So your second check, you're going to be making sure that you have everything that you need, right medications, the right dose, it's the right time and frequency and all of that. You're going to second check after you've pulled from the Pyxis, okay? Then you're going to complete a third check in the room at the bedside prior to administering the medications, okay? There's a reason for this, okay? Nurses are often interrupted, so it's very, very important that you follow this triple check rule, okay? If at any time you're interrupted during the medication administration process, you want to start over. Just where you are. If you're in the middle of the second check, almost finished, start over at the beginning, okay? We want to make sure that our patients are safe, okay? Now this one has literally gone viral on TikTok, okay? And so you don't have to just trust me. There's an entire nursing community out there co-signing exactly what I'm saying, okay? So if you don't believe what I'm about to tell you, head over to TikTok, nurse.lala, and see for yourself. You never, never, never want to verify or co-sign any medications that you haven't actually seen with your own eyes. That means you're looking at the medication, you're verifying it's the correct dose, okay? And this applies for your high-risk medications in particular, especially your insulin, narcotics, your heparin, anything that you have to double check with another RN. Make sure that you're not just casually signing off on things because that's your good friend, okay? You did not witness that. And so you're putting your credentials that you've worked so hard for, you're putting them up for grabs, okay? So I hope you enjoyed those 5 strategies. Thanks for tuning in. As always, keep saving lives and being great, okay? And I will talk to you next time.